Hey y'all, it's me, Dr. Smederman, Gyno Girl. So excited to be back doing some videos this year. I hope you had a good start to your new year. I was quite busy toward the end of the year. Went to Dubai to present and speak at the International Society for Sexual Medicine, and also did some vacationing there. And then unfortunately I had a death in my family and have been kind of recovering from that. So I'm back. I'm here to produce new content. I hope you guys like my logo in my studio area here. And I'm very excited to bring you a lot of new information. Today we're going to talk about the vaginal microbiome. So let's get at it. Alright guys, hey again, it's me, Dr. Smederman, Gyno Girl. If you're new to my channel, please like and subscribe here and we can get more information to you. I am launching a podcast, so hopefully you'll tune into that when you're driving or you need something to listen to. It's going to be a little unique. I'm going to have some patients who have gone through journeys tell their stories. I'm going to have my friends and experts on telling about different issues around women's health. It's called Gyno Girl Presents Sex, Drugs, and Hormones. So we're going to talk all good things that we speak about here, but in different details with different experts and different stories. So hopefully you'll tune in anywhere you get podcasts, and hopefully you enjoy it. You can let me know. Again, please like and subscribe to my channel. I'm a gynecologist and board certified in downtown Chicago. I am a sex med gynecologist as well as a menopause specialist, and with a special interest in fourth trimester care and pelvic pain. So today I want to talk about what inspired me today to talk about the vaginal microbiome. I was quoted in this article by the Daily Mail. The title was exclusive. This was for January 9th. Exclusive. Kourtney Kardashian launches $40 vagina supplements that claim to control odor. But experts accuse her of cashing in on women's insecurities about how their genitals smell. And you can see here I was quoted as one of the experts. Sorry if you love Kourtney. I don't have a problem with her in terms of what she does. I just think that what this is predatory. This type of marketing and products are predatory for women who are already concerned about their feminine hygiene issues and have been told and shamed about their feminine hygiene. And so today I want to talk about the vaginal microbiome, what to do if there is a smell, what to do when there's discharge, and all of that. So first of all, I guess we should start with what is the vaginal microbiome. So there's a lot of information with every type of microbiome these days. People are talking. So there's a lot of research nowadays about the gut microbiome and how it's related to your brain health and the gut-brain axis, the skin flora that we have. And there's more up-and-coming information about the vaginal microbiome and how it can be significant, and it's very important for your vaginal health and your overall health. And basically, if you think about what it is, it's a complex ecosystem of bacteria, fungus, other organisms that live inside the vagina, viruses they might be harboring in there. And for the vagina at least, it's really important that we stay at an acidic pH. That means a pH between about 3.5 and 4.5 or lower. And the way that is best for most of us that have vaginas is that we have to have predominance of the lactobacillus species, specifically Lactobacillus casparetus. And this is an important species that harbors in our vagina. When you think about, I know it's kind of weird to think about these little critters in our vagina, these microbiome in the complex ecosystem that exists in the vaginal tissue. But the lactobacillus is very important because of the lactic acid it produces and the acidity it creates to keep your vagina in harmony. And so when we have a normal amount of lactobacillus, especially this subspecies, you can see this is what the vaginal microbiome looks under the microscope. For the vagina at least, it's really important to have sort of this symbiotic relationship with the host and the vaginal microbiome, but also for the vagina at least, sort of a eubiosis state where you're just dealing with less heterogeneity of species and more homogeneity, so that, we like a predominance of lactobacillus. What we don't like is when you get too much heterogeneity, and that occurs with different susceptible conditions. When you have changes in the pH of the vagina, this can lead to an overgrowth of different types of bacteria that lead to different types of infections. So over 30% of vagina owners may have an imbalanced vaginal microbiome at some point, and this can lead to bacterial vaginosis, which you may have heard of, BV, yeast infections, recurrent UTIs, and much more. Why is it so important, the vaginal microbiome? Specifically, it's important because what's happening down there, we always talk about what's happening down there, there's a link between that and health outcomes in general. So when we talk about outcomes such as other sexually transmitted infections, if there's dysbiosis or things are not in harmony and you don't have a homogeneous amount of this type of lactobacillus, this might predispose the cells of the vagina to be able to, get infected by certain types of bacteria like chlamydia or other sexually transmitted infections. Patients that have dysbiosis of the vagina tend to have more susceptibility to HIV, so that's important. So the vaginal microbiome is kind of protective for that. Also, we know a lot how it can affect pregnancy, so that's kind of one of the new up and coming research in the past decade or more, is learning about how dysbiosis, where you have an overgrowth of the anaerobic bacteria like Gardnerella or the ones, these organisms that cause bacterial vaginosis, it can lead to preterm contractions, preterm birth. And if you think about the vagina as sort of the introduction to the world that babies experience, and if you are born preterm, it can lead to developmental delays, it can lead to cardiovascular, respiratory issues, and gut issues as well. So in that respect, if these are correlated, the vaginal microbiome is super important for functionality and good health throughout your life because of the importance of trying to get a delivery that is full term. Additionally, there are patients who are more susceptible to recurrent infections like bacterial vaginosis or candidiasis. I did a video about vestibulodynia. Remember, let me grab my vulva puppet. Remember my vulva puppet here? This is the labia majora, this is the labia minora, this is the clitoral hood, this is the clitoris. What we have here is the urethra, and this is the area between the inner labia minora and sort of the hymen ring and the vagina is called your vestibule. When I talked about, sexual pain, one of the biggest reasons that people have introital pain or pain upon initial insertion is related to changes in the vestibule. The vestibule is a unique tissue. As I discussed in this video, it is similar to bladder tissue. It is important to have a normal vestibule or normal tissue down there so that you don't have pain with penetration, with exams, or even sexual penetration, tampons, any of that. So when patients have provoked vestibulodynia, that may be secondary to hormonal shifts. That can be related to the changes in hormones that we always talk about. But what I'm referring to is when someone has chronic infections, and these infections lead to inflammation, which leads for many patients to an increase in nerve endings in the vestibule. So that's sort of an acquired neuroproliferative vestibulodynia, can lead to sexual pain. And that can lead to pelvic floor dysfunction, and they go hand in hand. So keeping the vaginal microbiome in check so that you don't get these recurrent infections are so important, because at some point, if you get these recurrences and you get a lot of yeast or bacterial vaginosis infections, then of course this can eventually lead to changes in that vestibule. So that is crucial for keeping a good healthy vaginal microbiome and healthy vestibule, So, your vaginal discharge that you create it can vary, right? So we talk about the organisms in the vagina, they can help create a discharge that's about 1 to 3 cc's that you might have. And, that's usually what's physiologic. And so what's important to remember is when you need to see your clinician about changes. And I'm going to talk basically some of the basics today, and then at a follow-up video, I'm going to get into recurrent infections and what to do about recurrent bacterial vaginosis, recurrent yeast, and such. And remember, the other thing that is linked to dysbiosis of the vaginal microbiome, other than sexually transmitted infections and preterm birth, there's also a link with fertility, we believe, in some capacity. So that's always important to remember as well. So vaginal discharge, remember, it's excreted in the vagina. It's created by not only your cells, your epithelial cells, and also results from what your vaginal microbiome does down there, the bacteria, the fungus, and the viruses. So the consistency can vary for normal physiologic discharge. It can be thick, it can be sticky. If you're not taking birth control pills and you're ovulating normally, you can have a sticky, sort of white, clear discharge. And so for most people, that's normal. And maybe a musty odor, but it shouldn't really be like pungent, fishy, or foul smelling. And so what affects the vaginal microbiome? It's important to remember that there are certain key players that can impact it. Whether or not you're having intercourse, that's kind of big. So multiple sex partners can create some changes in the vaginal microbiome. Not that changes in the vaginal microbiome are like sexually transmitted, but the changes that can happen from penetrative intercourse can actually change the vaginal microbiome and the pH and all of that. Blood can change the vaginal microbiome, the pH can change with that. That's why certain times people feel more symptoms off their period or on their period. Your hormone status and where you are in your cycle can change it. We've talked about genitourinary syndrome and menopause, which really should be the genitourinary syndrome of hormone deficiencies. So when patients are in different states in their life and they have hormonal deficiencies, this can lead to changes in that vaginal microbiome, causing a more basic environment, right? That's what happens when we lose estrogen and testosterone. You lose collagen, you lose these glycogen storage in the vagina that is so important for the lactobacillus to have lactic acidosis and everything like that, and that biochemical process, and that makes your normal discharge. And so the pH of a menopausal vagina, or a patient that's postpartum that is breastfeeding, or someone that has had cancer therapy, and sometimes even patients that are on birth control pills and have those vulvar vestibular changes from hormonal suppression, they also can have a more basic pH. And so therefore, when you have a more basic pH, you might be more susceptible to infections like yeast, which is candidiasis, or Gardnerella and other anaerobic bacteria, which cause bacterial vaginosis. And so what do you do when you have changes in your vagina? What factors, like I said, that influence? We talked about the hormones, we talked about sexual activity, condom use, and whether or not you're on antibiotics and all of that stuff that can influence your vaginal microbiome. Avoiding, that's why we do not recommend douching in the pelvic world, because that can change the pH of your vagina and lead to an overgrowth of anaerobic bacteria, which can lead to those symptoms of bacterial vaginosis. Those symptoms specifically can be a change in the color of your discharge, so yellow, green, brown. Anything that is not that clear or light white or more physiologic. Other reasons that you should seek attention for your symptoms is if you have itching, either vulvar itching or a little discomfort in the vagina and you're just uncomfortable. If you have pain with intercourse, of course, I'm always going to tell you to go see your clinician. The other issues that you would warrant you seeking attention from primary care or your gynecologist or any other clinician that you are able to go to is foul smell. So fishy odor, foul smelling odor, something that isn't your norm, right? So that could be a sign of bacterial vaginosis. And then itching, clumpy, white discharge, yellow, green discharge, those can be also signs of trichomonas, which is a sexually transmitted infection. Again, that fishy odor in there as well. Any kind of burning or discomfort, swelling in the vulva, increased vaginal discharge that wasn't there before, anything that strikes you as this is not my norm, you can then see your clinician to get some follow-up about. And so it's really important to maintain a healthy vaginal microbiome. You have to practice safe sex practices, obviously, to prevent those infections. Sexually transmitted, you want to avoid unnecessary antibiotic use, avoid douching, avoid these feminine hygiene products that are touted to make your vagina smell better, to make them, more appealing to other people and yourself. We have a lot of shame about, what goes on down there. And I think that's one of the issues I have with the feminine hygiene market, because they're really trying to monetize off of women's insecurities. And I said that in my quote. So we talked about bacterial vaginosis that can cause the foul-smelling discharge, the green discharge, the yellow discharge, profuse discharge, any irritation in the vulva and the vagina. Remember, vulva is the outside, vagina is the inside that you can't see. It's the canal. So just like I said in my recent video about Gillian Anderson's vulva dress, that the language is important, and we don't call our nose our ears. So we should call the vagina what it is and the vulva what it is, the labia what they are, the vestibule what it is, the clitoris what it is. We should use that language. And like I said in my video on my Instagram, I don't mind wearing vulva or clitoris on me. So this is a necklace by Sophia Wallace, which I think I showed you guys before. She's a great advocate for women's sexual health and an artist. So going back, that's bacterial vaginosis. There's antibiotic treatment for that. We'll talk about treatments and all of that in my next video. When you have an overgrowth, you have an antibiotic use, you're diabetic, you're more prone to increased blood sugars, then you might be more prone to get yeast infections, candida. And so those yeast infections can lead to pictures like this: swelling in the vulva, redness, irritation across the board, right? That looks very uncomfortable. And so we treat that with antifungals. And then, we're going to talk about how we treat recurrences in my next video. The other point I want to make is whether or not patients should be using probiotics across the board. This is Kourtney Kardashian's probiotic, where she has a whole mess of things that she's putting in this supplement that women are supposed to buy, that's supposed to be good for their vagina and make them smell like pineapples and whatever, which your vagina doesn't need to smell like that. But there is no medical, you know how I feel about the lack of medical research about women in general, but when it comes to vulvovaginal disease, sexual medicine and all that, we even have the least amount of research. When it comes to probiotics, it's really not recommended for the majority of the patients that I'm seeing in my office that are out there. Probiotics should not be taken for the purposes of making your vagina smell better or taste better or whatever the case may be. That is simply not something that is indicated for. In fact, probiotics are not even indicated for recurrent bacterial infections like BV or recurrent yeast infections. It's not indicated for either of those. The studies are very dispersive, like they don't support for the most part, and there's no consensus on the type of even if there is biologic plausibility on how probiotics might help with patients that have these recurrences, and I'm going to talk about that in my next video. But we do not have the studies that confirm that how long they should take them, what type of probiotic, what for the duration, for the amount that they should use, how much. We do not have the research to support using probiotics in recurrences. We don't have research to support what type of probiotic would be best, even though there might be biologic plausibility to this. And we don't have the type of research that would suggest that probiotics are really beneficial to patients with recurrences. So, I have patients that swear by them, and perhaps, I tell them that there's no data to support the use of it, but if they're happy doing it and they're happy paying for it, then that is their prerogative, and we are good with that. Anyway, so that's a good summary of what the vaginal microbiome is, how it's important, how it's protective for us. And so I think it's important for you to know what is going on down there, when to seek help, which is what I kind of reviewed in this video, and when to be suspicious of something wrong. There are other conditions that I treat, including cytolytic vaginitis, which I can talk about in the next video, desquamative inflammatory vaginitis, which is also has a foundation on dysbiosis, which you have maybe too much of different bacteria in the vagina. When they're, instead of being homogeneous with lactobacillus only, you might have more of one type of lactobacillus called innards, or you might have different types of anaerobic bacteria that create, like I said, a dysbiosis, which then precipitate an inflammatory response, which we think is causing this profuse amount of discharge in desquamative inflammatory vaginitis. So I'm going to talk about all that in the next video, so please stay tuned. And if you have any comments or concerns, you can suggest them down here in this, and I do read them even if I don't respond to them. I think that's about it, so see you next time. Please like and subscribe to my channel, and this is Gyno Girl. I'll see you next time, and we'll talk about recurrent infections, vaginitis. I'm also going to do a segment on Bartholin cyst, because I've been seeing more and more Bartholin gland cysts in the office of late. So let's talk about it in the next couple videos. Take care, guys. Bye-bye.